Yes. An update from Dr. Hamami regarding COVID-19.
Dr. Hamami, is he on the line?
Yes, good afternoon. Thank you, Madam Chair.
Good afternoon. Thank you.
If I may share my screen, please let me know if you can see the PowerPoint presentation.
Yes, we can.
Great, thank you. Mohanad Hamami, Chief Health Strategist, Wayne County. I'm going to go through some of the regular reports that we do about our cases in Wayne County. This is covering the period of last week between March 1st and March 6th. We are seeing a slight increase in the past 2 weeks. In fact, this week we have seen 22% increase in the confirmed cases, and we have crossed the threshold of 1,000. We were down back in January below 1,000. So hopefully this trend is a fluke and it doesn't happen going forward. That might be due to a little bit of the opening and the relaxation, but it should not be continuously happening. The death is still plateauing. It's not as much as we have been seeing, especially early on. And our testing is still robust, and cumulatively we have passed the 1 million tests in Wayne County. We are currently at almost 1.2 million tests. This is the 14 days look back on the cases. And again, the trend, that linear line is going upward. If you recall, when I presented 2 weeks ago, that was going down. And it is this bump here that we saw in the end of February and early March. So hopefully we will adjust that as we move along. These are the top 10 communities with the highest cases. No major changes. Still, the top 5 are still the same, or even the top 10 are still the same. They just trade places. But if you look at the total absolute numbers, then you can see that almost every community has increased in total numbers. And specifically when we talk about Dearborn, that has been since the beginning of the pandemic with the majority of cases. That percentage almost a month ago was 12%, now we're at 18%. And we're also seeing more of the youth testing positive. Our 7-day positivity rate is also climbing. It was declining. We were at some point in November at 13%. We would like to see it below 5%. We were going in the right direction. And currently, this week we have jumped over the 5% to 6.4. And this is something similar to what is happening in the state. So it's not only relevant to Wayne County, but it's all over the state. And again, I truly believe that it is because people feel more relaxed with the lifting of the restrictions. School-related outbreaks, we have several new ones that happened last week in several of our communities, 2 in Canton, Grosse Pointe Woods, Westland, Northville, Allen Park, and in Dearborn. Most of those are in students, and most of those are related to indoor sports. So again, as much as we know, we have worked with our schools and they're doing an amazing job in the mitigation and prevention, it is these activities that require the youth to congregate, and sometimes they let their guard down, and this is where most of those cases that we are seeing. As far as the variant, we have 17 cases in Wayne County of the B117. This is the UK variant. The highest number of cases are in Dearborn Heights, followed by Dearborn and Canton with 3 cases, and then 1 case at each of Lincoln Park, Livonia, Redford, and Riverview. There has been this morning, we announced that in Jackson, Michigan, there has been 1 case of the, I believe it's the Brazil variant. So we're watching that closely. There hasn't been any other variants in Michigan beside those 2, with that 1 new in Jackson. As far as the vaccine, we have seen an improvement in the allocation of vaccines. We're fortunate that we also got a very good boost of the Johnson & Johnson vaccine. Last week, we received about 14,000 doses of J&J. We are seeing less shipments of Moderna versus Pfizer. However, in total, between the first and second doses that we got with the J&J vaccine, we have received close to 112,000 vaccines as of end of last week. We have administered about 75,000 of those doses, and we redistributed close to 12,000 of these doses. When we say we redistributed, these are the entities that are labeled as COVID-19 providers and can administer the vaccine, specifically talking about what we're doing with Livonia Fire Department, Dearborn Fire Department, and some of the health providers that are certified by both the state and the CDC. So this is our vaccine inventory. Many of you know that last week there has been a change in the state's priority groups as announced by the governor. The change is that now included are the 50 and over with pre-existing conditions, as well as caregivers of children with special healthcare needs. And that went into effect yesterday. In 2 weeks from now, in March 22nd, they will include the 50 and 64 years that are not covered. So technically, it means anybody that is 50 and over can get the vaccine regardless whether they have a condition or not. Also, one group that was less announced, however, it was moved by the state, are the agriculture and food processing workers, and that started on March 1st. However, it was probably the news was obscured by this group that moved, which are the 50 and over. The other essential healthcare workers that everybody ask about, these are the manufacturing, the government, the postal, transportation, are still, as you can see, scheduled for May 1st. And so are those that are under the age of 50 with disabilities and pre-existing conditions. They are still at May 1st. Of course, all those dates are depending on whether or not there is enough vaccine supply. But with the indications that we're seeing, with more production of the vaccine, it seems that this timeline might still be applicable as we move along. How is Wayne County mimicking this? We have been since the beginning following the guidelines of the state. We did not move outside and included groups that should not be included. As I reported, we have done everybody in phase 1A and almost phase 1B in terms of the frontline essential workers. We are now getting the education, the teachers and education staff and law enforcement their second doses, as well as we still see the necessary healthcare, but in smaller numbers, and we are doing their doses as well. We haven't started the agriculture and food processing workers. We are currently assessing how many are in Wayne County. We received a list from MDARD. This is the Michigan Department of, I think, Agriculture and something. Don't quote me on the on those. But we received a list. We're filtering to who is in Wayne County. We identified close to 85 facilities in Wayne County. These vary between food processing to dairy products to animal food makers and all that. Our plan is to reach out to those entities, do a survey for their staff, how many they have, how many are willing to take the vaccine, and as soon as we complete that list, then we will start allocating some of the days for them. We are continuing to do the 65 and older. They are in progress. Some of the communities that we were there 3 weeks ago with the Pfizer vaccine are now at their second doses. So we're doing that. We also included for communities that we are still to vaccinate, that they should include the 50 and over with pre-existing conditions. Those communities that we have covered already, we are going back and allocating some days at our Wayne County Community Clinic, as well as Schoolcraft Community Clinic, and possibly in their communities to include the 50 and over. That leaves us with the last priority group that was moved yesterday by the state, and these are the caregivers of children with special healthcare needs. We are updating our online pre-registration link to know who those people are or where they are. There will be excuse me, there will be a link within the next 2 days, possibly, for anyone who fits this category to go online, submit their information, and we will schedule them, and we will start scheduling them as we are moving this population. Those that are 50 and over, again, as I mentioned, according to the state, this is close to the end of March, depending on, again, how much vaccine we are getting and the consistency of the vaccine. By that time, we will consider when to get them in line. Lastly, as many of you know, we started doing we started vaccinating our seniors in partnership with communities. So far in the past 2 weeks, we have vaccinated close to 20,000 of our seniors across the 4 regions. We are still using the regional approach. We have almost every community except 2 or 3 that are lower on the social vulnerability scale that have not been vaccinated by now. The 2 self-vaccinating or self-administering communities are still Livonia and Dearborn. In fact, Dearborn has taken all the responsibility for all their regions. They are doing Dearborn Heights, Redford, Allen Park, and that covers all their all their region. We have for this week, we have these almost 18,000 doses scheduled, and we are conducting those in some at the communities, as well as we are seeing many at our Wayne County Community College and Schoolcraft College with coordination with the community. So by end of this week, within we will have done 18,000, and we have already done close to 20,000. So that's about 38,000, which is quite an accomplishment. We still push forward. We still continue to add more to our vaccine priority groups, as long as we are still getting the vaccines that we need. I think this is my last, and I'm going to stop here and answer any questions that the committee might have.
Thank you for that.